Good morning, everyone. In today's lecture, we are going to discuss about protein energy malnutrition part 2. In the last lecture, we had discussed about what is undernutrition, what is overnutrition, then how we can indicate undernutrition, then etiology of malnutrition. Now, in today's lecture, we are going to discuss about the pathological changes caused by malnutrition. Then in the last lecture, we had discussed what is protein energy, malnutrition and the etiology, the causes of malnutrition. Today we will discuss the pathological changes that are caused in various organs due to malnutrition. Before that, we will also discuss how can we diagnose, how can we indicate that it is malnutrition. So there are certain indicators for diagnosing malnutrition. The first one is, and the most important one is mid upper arm circumference. Now, mid upper arm circumference. We had already discussed how can we measure mid upper arm circumference. So, if the value of MUAC is below 13.5 centimeter, then it is said to be abnormal, and this value is suggestive of the malnutrition. Then if the value is even below 11.5 centimeter, then it is a severe case of malnutrition. It is suggestive of severe malnutrition. Then another method is Shakir tape method. These are the indicators of diagnosing malnutrition. So Shakir tape method. This is a kind of a special tape, and this tape has colored zones. Three color zones are there: red, yellow, and green. The red is corresponding to the value less than 12.5 centimeter, that is wasting. Then yellow tape indicates value between 12.5 to 13.5, that is the borderline. Red color indicates value less than 12.5 centimeter, that is wasting. Yellow color indicates value between 12.5 to 13.5 centimeter. This is the borderline. And if the value is over 13.5 centimeter, that is the green, that is normal, MUAC. So Shakir tape method. Then another test is bangle test. In bangle test, what we do, a bangle which has the internal diameter of 4 centimeter, it is passed above the elbow. And if it's a case of severe malnutrition, then the bangle will be passed above the elbow. But in normal children, the bangle will not passed above the elbow. In fact, it would get stuck over there only. So bangle test, in which the bangle having internal diameter of 4 centimeter is passed above the elbow. In normal children, the bangle won't pass further, and in case of severe malnutrition, the bangle will pass above the elbow. And the last method is skin fold thickness. It is the indication of the skin fold thickness. It is the indication of the subcutaneous fat. And in this what we do, triceps skin fold. It is the representative of the total subcutaneous fat in children up to 16 years of the age. So triceps skin fold. It is the only representative of the total subcutaneous fat in children up to 16 years of the age. Now, it is usually above 10 millimeter in normal children. The normal value is 10 millimeter, but in a malnourished child, it might fall below 6 millimeter. The normal value is 10 millimeter, but in malnourished child, the value might fall below 6 millimeter. Then the pathological features. So malnutrition, it affects almost all the organ systems. And the main findings in various organs or tissues, they are pathological changes in malnutrition in various organ systems. Upper GIT, mucosa shiny and atrophic, and the papilla of the tongue is flattened. Now, here we are discussing the pathological changes of malnutrition in various organ systems. So, upper gastrointestinal tract, in this, what happens? The papilla of the tongue gets flattened and the mucosa is shiny and atrophic. Then, in small intestine and large intestine, the mucosa and the villi, they are atrophic. Brush border enzymes, these are reduced, hypotonic, and prolapse of the rectum, rectal prolapse. Then liver, fatty liver, then deposition of the triglycerides. In pancreas, exocrine secretion is depressed, endocrine function is less severely affected. The exocrine secretion is depressed, but the function of endocrine is affected, but in lesser proportion. Then glucagon production is reduced, insulin level is low, and atrophy and hypertrophy of the islets are seen. Then endocrine system, growth hormone is elevated, thyroid involution and fibrosis. Then adrenal glands, atrophic, and cortex is thinned. Increased cortisol and catecholamine activity remains unaltered. Then lymphoreticular system, thymus is involuted, loss of distinction between cortex and medulla, depletion of the lymphocytes, paracortical areas of lymph nodes, then depleted lymphocytes, depletion of the lymphocytes. Then in central nervous system, head circumference and brain growth is retarded. Changes they are also seen in the dendritic and morphology of the dendritic spines. Then on CT MRI, abnormalities in auditory, brainstem potentials and visual evoked potentials. Then cardiovascular system, changes are seen in cardiac volume, muscle mass, and electrical properties of the myocardium. Systolic function is affected more than the diastolic function. So these are the pathological changes in malnutrition in various organ systems. Now, clinical features of malnutrition. So, clinical features of malnutrition in case of mild malnutrition. Now, according to Indian Academy of Pediatrics, there are grades of malnutrition. 4 grades are there. Grade 1, in grade 1, it is indicative of mild malnutrition. Grade 2, moderate malnutrition. Grade 3, severe malnutrition. And grade 4, very severe malnutrition. And this classification is based on weight for the age. So, here are the clinical features of mild malnutrition. So mild malnutrition, it is most common between the age of 9 months and 2 years. And the main features are growth failure. Now growth failure, how can we say growth failure? Now growth failure, it is manifested by slowing of the growth or complete stoppage of the linear growth. So the growth failure, it is manifested by slowing or cessation of the linear growth or decline in the weight or body weight remains static. So static or decline in the weight. So growth failure, it is manifested by static weight or decline in the body weight, decrease in the mid upper arm circumference, delayed bone maturation, normal or diminished weight for height, and normal or diminished skin fold thickness. So basically growth failure, it is indicated, it is manifested by static weight or decline in the current weight, decrease in the mid arm circumference, then diminished skin fold thickness, diminished weight for height, or slowing of the linear growth or cessation of the linear growth. These all are the manifestations of growth failure. Then infections. A high rate of infection involving various organ systems are seen. For example, gastroenteritis, pneumonia, and tuberculosis. Then anemia might be there, mild to moderate, and any morphological type of anemia could be seen in case of mild malnutrition. So anemia may be mild to moderate and any morphological type can be seen. The activity is diminished. Skin and hair changes, they occur, but they occur very rarely. Skin changes and hair changes, they mostly occur in moderate to severe malnutrition. But in my mild malnutrition, skin or hair changes may occur, but in very rare cases. So these were the clinical features of mild malnutrition. And mild malnutrition, it is mostly common between the age group of 9 months and 2 years. Now, clinical features of malnutrition, moderate to severe. Now, moderate to severe malnutrition, it is associated with one of the classical syndromes, that is marasmus, Kwashiorkor, or with manifestations of both, that is marasmus and Kwashiorkor. So till now we have discussed about the clinical features of mild malnutrition, in which we had discussed anemia, activity, skin changes, hair changes, infections, and growth failure. Now we are discussing about moderate to severe malnutrition. So moderate to severe malnutrition, it is associated with the classical syndrome, marasmus, Kwashiorkor, or with both, that is marasmus, Kwashiorkor. So now discuss what is marasmus. Now here it is marasmus. It's a picture of marasmus and Kwashiorkor. Now we will discuss what is marasmus. So basically marasmus it results from rapid deterioration in the nutritional status. Marasmus, it's a condition which results from rapid deterioration of in the nutritional status. Acute acute starvational condition, or any acute illness over the borderline nutritional status could precipitate this form of undernutrition, that is marasmus. Means in this we say that marasmus, it is a clinical syndrome which results from rapid deterioration in the nutritional status, and when the nutritional status is on over the borderline, and at that time any acute illness or any acute starvational condition could precipitate marasmus, could precipitate this form of the undernutrition when the nutritional status of the child is already over the borderline. At that time, any acute illness or any acute starvation condition could precipitate this form of the undernutrition. And marasmus, it basically results from the rapid deterioration in the nutritional status. It is characterized by marasmus. Marasmus is characterized by marked wasting of the fat and the muscles because these tissues are consumed to make energy. The main sign of marasmus is severe wasting. The child appears very thin, that is, the child is having only the skin and the bones and has no fat. So the main sign of marasmus is severe wasting, because wasting is there because the fat and the muscles, these tissues are consumed to make the energy, and child has no fat, he has only skin and the bones, and the child appears very thin. There is severe wasting of the shoulders, severe wasting of the buttocks, arms, and the thighs. Now this is a picture clearly showing child with severe acute malnutrition. The hairs are dull, lusterless, sparse hair over the temples. Then temporal hollowing. Then loss of the buccal pad of the fat. The child has a anxious look. Then loose fold of skin in the gluteal region having a baggy pant appearance. Now this point is for this image. This loose skin folds giving a baggy appearance. Loose skin folds over the buttocks giving a baggy appearance. The skin is loose, hanging down. And in this picture, child has an anxious look. It's a case of severe acute malnutrition. This face is resembling monkey face. The loss of the buccal pad of the fat that creates a aged or wrinkled appearance. Monkey face. Then axillary pad of fat is also lost. Baggy pant appearance. The loss of the buccal pad of the fat creates the aged or wrinkled appearance that has been referred as monkey faces. Baggy pant appearance refers to loose skin of the buttocks hanging down. Now this sentence, baggy pant appearance refers to loose skin of the buttocks hanging down. This, baggy pant appearance. And monkey face due to loss of the buccal pad of the fat that is creating the aged appearance or wrinkled appearance that has been referred to as monkey face. Then axillary pad of the fat is also diminished. But these children, they usually have an anxious look on their face. Still, apart from their condition, these children are very alert and there is no edema. Affected children may appear to be alert in spite of their condition and there is no edema. So these were the clinical features of marasmus. Thank you. In the next lecture, we will continue with Kwashiorkor. Thank you.